recording here. I think we are good to go. So close this one, close this one. So welcome everyone. Yesterday we looked at epidemiology, where we focused on understanding what epidemiology is, and in that presentation we noted that epidemiology is concerned with understanding the distribution of health-related events and determinants of health in a particular population, and applying this to be able to improve population health. Okay, so that is in summary what we looked at in terms of understanding what epidemiology is. However, in that presentation we highlighted the fact that when we talk about health-related events, we're talking about the things or matters that affect the health of the population. Okay, so in this we talk about communicable diseases, we talk about the non-communicable diseases, we talk about wars, we talk about the injuries, we talk about the risky behaviors amongst the population, different exposures that they come into contact with, anything that you can think about that influences health. Okay, that is the interest of epidemiology. We want to know what are the patterns, what are the trends, what can be done. Okay, what is causing what, who is suffering from what, and where are they? Okay, that's the interest of epidemiology. Now let's look at these diseases more. Okay, and this presentation basically is to understand the diseases that can happen in a population, and how they are actually caused, and how can we reframe the ways in which different diseases are caused in a way that will allow us to implement interventions to improve population health. That is our interest in this discussion. So we shall talk about the concept of diseases and disease causation models, and how we can really apply them in the prevention of diseases. So starting with health as a concept, from your first lecture about public health, you must have looked at what health is. We usually prefer to use the definition by WHO that says that health is defined as the optimal state of complete well-being in aspects to do with physical, mental, and social well-being, or psychological well-being, and not merely the absence of the disease or infirmity. This is the accepted definition, or the widely used definition for health. Okay, what this definition emphasizes that health is not about you not having a particular disease. Okay, it's about how well you are in all aspects, to do with physical well-being, to do with social well-being, to do with psychological well-being. So it has a number of dimensions. Okay, so that is the definition that we are going to be using. And then of course we are looking at diseases. So when we talk about diseases, we are basically referring to the fact that your body is not functioning normally. There is a deviation from normal functioning of your body, or any part of your body. Okay, so this, if you go to the physician, you say, I'm feeling headache, I'm having this fever and joint pains, the physician will think that perhaps you're having malaria, and then they will run some investigations, laboratory investigations, and determine that indeed you have malaria, and then they will treat you. Okay, so that when they treat you, they basically give you a diagnosis. Okay, they say, okay, based on the history that we have gotten from based on the laboratory investigations that we have done, you are suffering from malaria, which is a communicable disease. So they give you a diagnosis, okay, based on what they have investigated. So when things are not moving right, when there is dysfunction, either it is anatomical, whether it is physiological, whether it is psychological, that is what we term as a disease, okay? And then when we talk about illness, illness is a subjective perception of one's health. This is to say that it is possible for you to feel unwell, and then you go to a physician who do all these investigations and they will not find any disease. But for you, you don't think that actually I'm not well. So your feeling of about your health, your level of health, is what we call illness. Okay, so it can be accompanied with a number of discomforts that you can be experiencing. It could be pain, it could be that you are fatigued, it could be different things that you can be experiencing. Okay, so that means that, and it means you can feel unwell, but there is no particular diagnosis or disease that is being ascribed to you. Okay, so that is a possibility that can happen. Okay, so we have different diseases, and it is very important for us to know the different categories of these diseases. This is basically to say that when we know these categories, we can know how to deal with them. Okay, we have what we call infectious diseases. Sometimes we call them communicable diseases. These are diseases that are caused by a particular agent. That means they are being transmitted by a particular agent from one person to the other. Okay, so these agents can be microbes, viruses, bacteria, protozoa, fungi. Okay, these are the ones that are causing these diseases. Okay, these agents are the ones causing these diseases. Okay, HIV, COVID-19 virus, that is the coronavirus, and many others, tuberculosis, malaria, and things like that. Those are infectious diseases. And then we have the non-communicable diseases, the ones we often call the silent killers in public health. Why do we call them silent killers? Sometimes they don't manifest easily. Okay, so someone continues to have, for example, hypertension, and they are unaware that they have hypertension. By the time they are aware that they have hypertension, when it is actually too late, because when the hypertension has started to cause damages to other organs of the body. Okay, so that's why we call the non-communicable diseases as silent killers. For these ones do not require an agent to be transmitted from one person to the other. They are related to environmental factors, genetic factors, and also lifestyle factors contributing to either diabetes, cancer, hypertension. These are all non-communicable diseases. And in developing countries, we use the word or the phrase double burden of disease to refer to the fact that we continuously have communicable diseases happening at the same time together with the non-communicable diseases. So we have a double burden of disease. Okay, the communities or societies are developing at a rapid state. Urbanization is increasing. Sedentary lifestyles, eating processed foods, always contribute to to these non-communicable diseases. So they are on the rise, okay, and that's why we are experiencing this. And this is also something to do with what we call epidemiological transition. The patterns of disease are actually changing. There is a significant decrease in communicable disease, but also non-communicable diseases are increasing. So this is a concept to do with epidemiological transition. And then we have what we call occupational diseases. At your workplace, you can be exposed to agents that can put your health at risk. If you work in a mine, it means that you're exposed to all these chemicals that will eventually cause different conditions, causing, for example, if you're exposed to asbestos, if you're exposed to smoke, these can cause different diseases, for example, cancers. If you're exposed to a lot of noise, then you'll be exposed to your risk for hearing loss increases, and many other things. Okay, so all the conditions that are associated with the exposures at the workplace are called occupational diseases. And then environmental diseases. We know that environmental factors play an important role in the transmission of different diseases. Malaria has an environmental component, typhoid has an environmental component, and many other diseases. Okay, so diseases that emerge from poor sanitation, cholera, all these are related to the environment. Issues to do with environmental pollution, leading to asthma and other allergic reactions that can affect individuals. These are all environmental conditions. Okay, and then within the environment, there are also exposures due to radiations that can come from different sources. Okay, still these environmental exposures can be also related, definitely, also to the exposure of an individual to these environmental pollutants can also be related to where they are staying and or maybe where they are working. Okay, so here we can talk about the concept of, for example, environmental justice. Often, people who are poor are the ones living in areas that are highly polluted. Okay, so let us assume that we have a factory that is producing certain products, and that factory is actually polluting the environment. The owners of the factory are not staying around. They are actually staying in the most poor places. This is to say, they stay in upscale urban areas with good environment. Yet with their factory is in a place that is surrounded by people who we categorize under the low income category. So with the concept of environmental justice, we are saying that how can we make sure that pollution that is happening because of this factory, the burden and the benefits are actually distributed equally. Okay, so the people who get a lot of money out of this factory are not affected by the pollution, but the people who get less money out of this factory, because they are casual laborers, they are the most affected by the pollution. So that is an issue to do with environmental injustice, or a concept related to environmental justice. So these communities will have these diseases that are resulting from pollution. And then we have genetic diseases. These are diseases that can be transmitted from the parents to the young ones. Okay, this happens because there is abnormality in the genetic material, the gene A, or chromosomes or genes. These ones are affected, and this when fertilization happens, this same defect is transmitted to the offsprings. Okay, and some of these conditions include sickle cell anemia, Down syndrome, and Huntington's disease. These are genetic conditions. They happen because there is a damage to the genetic material, where we are talking about the genes and chromosomes. And then nutritional conditions, or nutritional diseases. Diseases that are happening because of either undernutrition or overnutrition. Specifically, in our case, we have undernutrition. Okay, and this is where you have deficiencies in energy, calories. Okay, calories and proteins are deficient, and we have severe acute malnutrition. Acute malnutrition basically resulting into stunting, resulting into wasting and other issues. Okay, so those are nutritional conditions, but we also have conditions associated with overnutrition, overweight, or obesity. And then another problem is micronutrient deficiencies. Okay, deficiencies in minerals, deficiencies in vitamins, and other conditions. And then we often forget to talk about injuries and trauma. Injuries happen either intentionally or unintentionally, but they result into death, mortality. They can also result into disability. Okay, so often the causes of injuries could be road traffic accident, gun violence, and other things. Even wars contribute to these injuries. Another issue is the silent trauma that is associated with, for example, wars. Okay, so injuries and traumas can be put in one place, in one category. And then mental diseases. These ones are also sometimes very forgotten. They are the neglected conditions. Why do I say so? They are not given a lot of attention by policymakers, and not enough resources are devoted to really improve mental health. Okay, so mental health results into still morbidities. Mental disorders result into morbidity. If you have a lot of people having, let us say, they are depressed, or they are having suicidal thoughts, or they are having mania or schizophrenia, these conditions, of course, when individuals have them, their productivity goes down. Okay, their productivity goes down, and when it goes down, it means basically the country is not moving forward, because you have a lot of people who would have been very productive but are not very productive because of these conditions. But also, of course, mental disorders result into mortality. Depression can result into suicide, and suicide rates, often it is very hard to quantify them, but definitely we need to acknowledge that they happen. And then we change the gears and look at what causes these diseases. Of course, we already talked about the fact that some of these diseases are caused by genetic factors. We talked about nutritional factors. We talked about the microbial agents. So why should we really care about looking at disease causation modalities or models? Okay, how are diseases being transmitted from or within populations? So for us in public health, we recognize that diseases do not necessarily have one contributing factor. Diseases are caused by multi factors. Many factors come into play to cause a particular disease. By the time you have malaria, there are issues to do with the environment, there are issues to do with you who has gotten this malaria, susceptible host, there are issues to do with how the mosquito is actually carrying the agent that causes this malaria. Okay, so it is not, we are not looking at one factor. Okay, so giving an example of malaria, you have seen that your environment, when you have bleeding areas, you have bushes around, you have stagnant water, you have dark corners, these are contributing to malaria. So that is the environment. And then when you look at the mosquito and the plasmodium species that cause the malaria, what are the biological aspects that make them to really lead to malaria transmission? And then you look at individuals. Children are more susceptible, for example, pregnant women are also more susceptible. What happens when someone is being infected with the plasmodium species that causes malaria? Okay, so in public health, we recognize that whatever disease that you talk about, they are always contributing factors. Okay, there are several factors that come into play that will affect the occurrence of particular diseases in a particular community, and it is very important to look at them all so that we can really address we can be able to address these diseases in a comprehensive way. So we use disease causation models as frameworks, to basically explain and understand how diseases happen in a particular community. What are the different factors that result into diseases occurring in a particular population? So when we talk about disease causation models, that is what we mean. Okay, if we look at malaria, for example, what I've just illustrated with the malaria case is what we call the epidemiological triad, where we have the environment, the host, and then the agent. That is one of those disease causation models that we are going to look at. So when we talk about disease causation models, we are referring to how the different factors, conditions interact to affect the occurrence of a particular disease in a particular population. And then before we look at all these different models, we want to first understand what we call causal relationships. Okay? With this, it's basically the understanding that there should be an event A for a disease B to happen. So the event A is the cause, and then the disease B to happen is the effect. So we basically, when we talk about causal relationships, we're talking about the effect, the cause and the effect. The cause and the effect. So when discussing these different models, we are basically saying that when this happens, this will happen. So when you have a cause A, you will have a disease B. This is what we mean by causal relationships. They enable us to know what risk, it's basically about risk factors. If you have this risk factor here, or we have this exposure here, you will have a health outcome. Y or Z. So let's move forward. So to understand the causal relationships further, we have some concepts that maybe we need to know. One is a necessary cause. Necessary cause. This is to say that that factor that factor should be present for the disease to be there. Okay, so you cannot have malaria without you being infected by the Plasmodium species. Okay, that is one point. Okay, so that is the necessary cause. That means that the Plasmodium should be the agent that has affected you for you to get the malaria. So if you don't have the Plasmodium species in your blood, then you will not have the malaria. So that means that that Plasmodium species is the whether it is vivax, whether it is whatever species of Plasmodium you're talking about, it should be present, and we call that a necessary cause. Okay, so in this case we're saying that if a person is having cholera, then Vibrio cholerae, the agent causing this condition, should be there, and that is what we call a necessary cause. And then we have what we call a sufficient cause. Okay, a sufficient cause, they work to get, these are factors that should be available together, not in unison, and not in isolation, I mean. Okay, they should not be in isolation. These factors should all be present for the disease to happen. So this is actually the sufficient cause is about acknowledging the fact that diseases have multiple causing conditions or factors, or multiple causative factors. Okay, so sufficient cause, for example, when we talk about an individual who has been exposed to smoke, whether active or passively, and then is also exposed to asbestos, and then has a genetic predisposition to getting, let us say, lung cancer. So this is to basically say that when you have all these exposures in an individual, it is likely that they will get the disease, which is lung cancer in this case. So we are talking about, find a point here, we are talking about smoking, which is either passive or active, and then we have exposure to asbestos, and then we have a genetic predisposition. These factors, if you have them in an individual, they can be sufficient to cause a person to develop lung cancer. So that is about sufficient cause. So when we talk about sufficient cause, that is what we mean. Okay, so if all these factors are present in an individual, then it's really likely that they will develop the disease. Contributory factor. The factor really contributes to the occurrence of the disease, but when we look at it as a single factor, it may not really be sufficient to cause the disease. Okay, so let us go to an example of TB. So let's go to an example of TB. With the TB, you can be exposed to Mycobacterium tuberculosis, but your immunity is actually competent. So that means you will not get the TB. But the moment your immunity declines, then the TB, tuberculosis can actually now arise, and then it starts affecting your lungs and your body system. Okay, so this is to say that we have certain factors which increase your risk of the probability of you getting a particular disease, but they alone do not mean they cannot cause a disease to happen on their own. So we can say high blood pressure can result into heart disease, but you can have other contributing factors working together to make sure that to contribute to the heart disease, but the high blood pressure alone may not. Okay, may not, and that is the key word, may not. Okay, really result into heart disease. Okay, so this is very important. So we have, for example, if we talk about, for example, human papilloma virus that is linked to cervical cancer, it is said that the age at which girls have their first sexual encounter contributes to the likelihood that they can get cervical cancer due to the human papilloma virus. That means that it does not necessarily mean that everyone who perhaps has the first sexual encounter earlier will actually have cervical cancer. No. Okay, so it is just a contributory factor. So you have different factors that can play their different roles, and then eventually the person having a particular disease. So it is also closely linked to what we are calling probabilistic cause. It's about probability. Okay, exposure to a particular agent does not necessarily mean that you will get a particular disease. Sometimes it is not the case, but it can increase your risk, but it alone may not cause the disease to occur. So we are saying that smoking increases the risk of getting lung cancer, but it alone may not really cause lung cancer. So that's why you have individuals who have been smokers and actually heavy smokers, but they are not having lung cancer. Smoking does not guarantee that you get lung cancer, but it contributes to the risk of you getting lung cancer. Okay, so that is very important to note. Now let's go deeper into these models now, having understood how diseases can happen and what factors can contribute to these different diseases. From this discussion so far, we have noted that diseases cannot be caused by single factors. Okay, we will have different factors coming into play to influence the occurrence of particular diseases. So the models that we have, 5 of them here, basically continue with that assumption. Okay, we go with that assertion that diseases are caused by multiple factors, okay, and not singular factors. So let's look at the epidemiological triad. This is very common. Often is something that we look at very fast when we are talking about epidemiology. It's the acknowledgement that we have the agent, we have the environment, and the host interplaying. We have these factors interacting to cause a particular condition. Okay, so usually the agents we are basically talking about the microbes, whether viruses, whether it is bacteria, fungi, protozoa, and others. And then the environment is basically our environment. This can be the immediate environment, can be the built environment, can be the natural environment. This plays an important role. It can actually be, you may not necessarily focus on our environments per se, but the environment where the agent also stays, because we are basically sharing the same environment with the agent, the host and the agent, and the same environment. Okay, the bleeding or the habitat will be different, but basically the environmental conditions are the same. So whether it is sunny, whether it is rainy, whether it is whatever environmental conditions that we have will affect both the host and then the agent. and then the host where the agent actually lives. Okay, so we can talk about humans as the host, but we can also talk about animals as the host. Sometimes some of these diseases move from animals to humans, so it is very important to look at the host holistically, such that if we are to break the cycle of transmission of these diseases, then it could be done that way. So that relationship where you have the agent, the environment, and the host, they are not living in a static manner. We have an interplay. We have an interplay of situations where we have the host being very strong. We have situations where the agent being very strong. So there is always that it's like a seesaw. It's a seesaw. There is that swinging around, depending on the prevailing environmental conditions. So sometimes you can have the agent being very pathogenic. That means that it is very powerful. It can cause the disease even with very few numbers. And then you have the situation where, okay, the host is actually very strong. That means that the agent is becoming less powerful and not very, very pathogenic. Okay, so that is when you have the host be outweighing the agent. Okay, and then the equilibrium, of course, is when the agent and the host actually they're balancing each other out. So this is what we call the steady state. Okay, but of course in the natural settings you don't have a steady state happening. You will always have environmental changes happening, either in favor of the host or in favor of the agent. In this case, it is in favor of the agent, and in this case, the environmental changes are in favor of the host. Okay, so that's why we have, for example, peaks in malaria. Okay, when we have a lot of rains, then we are going to have a lot of malaria cases. But when it is relatively dry season, then you're going to have less malaria cases. So you have a swing. Okay, and it's the same thing that happens even with diarrhea. Often here, when it is actually not raining, when it is in the dry season, that's when you have a lot of malaria cases. Okay, so we move to the application of this epidemiological trial is that you can look at a disease using those different components and address the issue. So, for example, if you're looking at the host, there are many things that you can really do to improve the competence of the host to be able to resist the agent causing a disease in them. Okay, so if you have children being well breastfed, if you have people eating healthy, if people are exercising, if you vaccinate them, if you manage the chronic conditions, these things empower the host and they become very competent in managing or in resisting being infection from these agents. If you have a child who is well breastfed, it means that their immunity is boosted enough to resist agents that can cause diseases. If you eat well, it means that your immunity is boosted. If you are immunized, still immunity is boosted. If you have proper hygiene, sanitation, and personal hygiene, means that these agents are actually are prevented from entering into your body. And then when we move to the other element, the agent, of course you need to know which agent is causing one disease and know its life cycle, know where it bleeds, know where it the times it causes havoc. Okay, so for example, if you're talking about mosquitoes, we need to know the mosquitoes that cause malaria, that transmit the organism that cause malaria, because the mosquito is basically a vector. So we need to know the habits of this mosquito, female Anopheles mosquito. So we need to know where does it breed, at what times that can it bite, what chemicals can repel this mosquito, and a number of things. For example, we can also vaccinate. Pregnant women are given Fancida to make sure that they cannot be attacked by malaria and things like that. So vaccination, environment, improving the environment. Not that. Sleeping under the mosquito net. All these are related to making sure that the agent is kept away. And then the same thing, the environment has to be clean, no stagnant water, no bushes around, and preventing all those, or removing all those environmental factors that can contribute to the bleeding of these agents. Okay. And then, of course, for you to address these problems appropriately, you need to have continuous measures. For example, in epidemiology, we are concerned with surveillance, epidemiological surveillance, getting to know what diseases are happening in particular populations, and then telling people about these diseases and how they can actually control them. And then if there are outbreaks, then the response team has to run into action to make sure that interventions are put into place. Conduction of research and also improving in these interventions is also these are some of the things that can be done by the public health team. Okay, so this basically fall under epidemiologists, the functions of epidemiology, or what epidemiologists will actually do in case we have these conditions happening. So that basically gives us an idea of how most of these communicable diseases can be dealt with. Okay, so if you get a disease, know the agent, know the environment, and then know the host characteristics that favor the transmission of this, and then be able to act. So let's move to the second model, which is the web of causation. Okay, the web of causation recognizes that the cause of a particular disease is not linear. It involves an interaction of different factors in ways that you can actually fail to imagine. So, for example, if a person is to have heart disease, the heart disease can emanate from the diet, okay? But the diet is influenced. The diet itself may not directly influence whether they will have the heart disease or not, if you look at their lifestyle. So, for example, you can have the diet being very composed of high calories, a lot of fats, a lot of processed foods, and then you have other factors that can, for example, try to mitigate the poor diet. Okay, so for example, someone is not having a genetic predisposition to a particular condition, someone is active or is living an active lifestyle, or whether the health system is actually very, very, very efficient, and that they can actually, the health system can detect that their cholesterol levels Okay, we have screening programs for these cardiovascular conditions, and this perhaps the payment for these screening programs is free. So that means that people can easily go for screening and know that their cholesterol level, for example, is very high and they need to do something about it. So by the time someone really dies of heart disease, there are many factors. In this case, I've just mentioned a few. I've mentioned diet, I've mentioned genetic predisposition, I've mentioned their lifestyle, I've mentioned the health system, okay, and then many other things, okay. So when you have a patient reporting to you in a clinic with, for example, diabetes, that diabetes is not caused, may not be looked at as being caused by one factor. We have many factors that interplay in different ways. Okay, so that is what we call the web of causation. It is the recognition that we have different factors that interact to cause a particular disease. And this brings us to the concept that we earlier talked about, the concept of multifactorial aspect of diseases. Okay, so this looks very complicated, but we can actually break it down to look a little bit okay for us to understand and be able to act. Because if we have it that way, you will ask yourself, where are you going to start from as a public health person? But if you break these factors at different levels, you will be able to say, okay, let us intervene at this level. So we can break these factors at 3 levels. What we call micro level. This is to look at what happens at in the organs of the systems that are manifesting this disease. Okay, so what is happening there? What factors are at play? And then we come to the individual factors. Okay, the person's genetic makeup, the person's lifestyle, the person's physiological parameters. For example, what I talked about, cholesterol levels, the blood pressure, all these, the heart rate, they all tell us the probability or the likelihood that someone will actually develop a heart problem. And then at the macro level, the bigger level, this is where we talk about socio-economic, cultural, and evolutionary determinants. Okay, so political, socio-economic, these are now at a larger scale. This is where we now talk about national policies, issues to do with health systems, issues to do with health funding and things like that. Now, this model called the sufficient component cause model brings us back to what we earlier looked at when we talked about the necessary cause, when we talked about the sufficient cause. It takes us back there. So let's look at this. The sufficient component cause model is about knowing that you still refer back to different factors combining to result into a particular disease. But the key word here is sufficient. Sufficient. Okay? That means that you can have certain factors that can contribute to a disease, but the disease may not really happen. That is an issue to do with perhaps these factors are not sufficient to cause the disease. Okay, so the major emphasis here is to do with the what we call the component causes. So here you have different causes, A, B, C. These are the different causes. You can have a disease that can actually have multiple ways in which it can actually manifest. Or the causal pathway, how not everyone gets, for example, heart failure in the same way. Not everyone gets heart disease in the same way. Okay, so this is what basically we are saying here, that you have different factors that will have to combine in order to have a particular disease happen. But the issue of sufficiency is what actually differentiates it from the other model, that the web of causation that we have just talked about. So okay, so the sufficient component cause model emphasizes components. These are basically factors that should be present for a disease to happen. Okay, so for example, for someone to get, like, for example, a heart disease, then it could be, you could have genetic predisposition issues, environmental exposures, their lifestyle, and physiological parameters that we already talked about. These factors act together in order for the disease to happen. But there is one underlying principle, which is that all these factors are actually should be present for the disease to happen. All these necessary components should be there in sufficient levels for the disease to happen. Okay, so a combination of component causes forms what we call a sufficient cause. Okay, so we have the necessary component, which we said must, in our earlier discussion, was that it must be there. Okay, and then in this case we are looking at all these different factors have to be very present to form a sufficient cause, and when we have a sufficient cause, then the disease will happen. Okay, so that is the sufficient cause, sufficient component cause model. Okay, so we have different we can look at the interaction of these different components. So for example, the example I gave earlier on was that the person is not really eating well, but they are exercising. So you see that the unhealthy diet is of course a negative, it's a risk factor, but the exercise is a positive. That means that it is a protective factor. So if we have these factors acting in different ways in whether the disease will happen or not, that means that the interaction can be one that counters or one that adds up and increases the risk further. Okay, so when you have one that counters, we talk about antagonistic. Okay, so this is to say that the joint effect of the multiple component factors is actually less than the sum of the individual effects. Okay, so if we have poor eating habits, and then combine it with regular exercising and perhaps good genetic profile that is not linked to this heart diseases, then you have these factors balancing out, okay, antagonizing each other. And then when one factor combines with another, okay, such that the impact increases the total the outcome, the likelihood of the outcome happening, then we talk about additives, additive interaction. So let me try to illustrate that. Okay, let me get a rubber here. So basically, on this slide, we are illustrating that in component causes play roles in causing the occurrence of a particular disease. Okay, you have different factors that are going to come into play in the occurrence of a particular disease. So, for example, if we talk about hypertension, we already know that the lifestyle habits influence the occurrence of hypertension. So, for example, taking salt that has a lot of, taking food that contains a lot of salt, and then not exercising enough, and then genetic predisposition, all this can really contribute to hypertension. But you can have also factors that are very protective. Okay, so for example, you can have an individual who is having the opposite of what we have talked about, or some of them. So you basically have a situation. Let me add a slide here. So you have a situation where we have positive factors. I'm calling them positive because you have they are good for health. And then the negative factors, they're actually bad for health. Okay? So let's look at what this is. We are looking at hypertension. We are looking at hypertension. So what happens with hypertension? So if you are a good person, you are taking a good diet. So that diet is having a lot of vegetables, low salt, and then so low cholesterol. And then you're also exercising, you live an active lifestyle, and you also don't have a genetic predisposition to this, you don't have stress. Okay, now here on this side, stress is too much, your diet is poor, and then you have genetic predisposition. So you see, these are the bad signs. So it is not very common that you as an individual will actually have all the things that they go. You will have poor nutrition, poor lifestyle, all of them at a go. You can have stress, but when your diet is okay. You can have good diet when you have a lot of stress. So these different factors interplay in different ways. So others cancel themselves out. Think about it that way. It may not really be what really happens, but think about it that way. That you have one factor this side cancelling another factor this side, basically antagonizing, if you can think about it that way. And then you can have one factor combining with another. So you have stress, at the same time your diet is not good and you're not exercising, you're inactive. All these factors, if you are giving them scores of 3, it means that you are having 9. When you have this aspect, that is what you call additive. Okay, the factors and pile on one another to either cause or not cause a particular condition. That is the first concept that we have here. The sum of the individual, the impact of the individual component cause is equal to the sum of the individual is what the total sum of all. But you can have a situation where when genetic predisposition is matched, is combined with you can have a situation where genetic predisposition is combined with stress. So if we give a score of 4 here, and then you have a score of 4 here, and then when you add the 2, you actually get 10 instead of 8. That there is amplification of the effect when you have the 2 factors available. And that is what you call synergistic interaction. A synergy, you have a synergy. When you combine A plus B, assuming technically you're supposed to get C, but in a synergy, if you combine A plus B, you get F, which is bigger. So it's the same thing we are saying, that if you have a factor with maybe a score of 4, this is hypothetical, plus 4, instead of getting 8, you get 10. This is a synergistic interaction. Okay, so we also have different factors doing that. Yeah, I think we have looked at this. Okay, we have looked at the additive interaction, we have looked at the synergistic, we have looked at the antagonistic interaction. Okay, so with the antagonistic, if I'm to use numbers to show that, is that the effect of the different component causes, the joint effect is less than the sum of these factors here. So if you have 4 plus 4 here, you get a 6. So that means there is some level of opposition here, antagonism here. That is that. So we can apply that sufficient component cause model in looking at different behavioral practices or lifestyle practices that can impact on health. And we see that a person who smokes and they have a genetic predisposition, it's likely that you're going to have a synergistic interaction and they are likely to have the disease. The chances are very high. Okay, a person who has obesity and the type 2 diabetes and the type 2 diabetes genetic predisposition and adds additively, basically interacts additively with the unhealthy diet, and this will really increase their likelihood of developing type 2 diabetes. Okay, so that is very, very key. So it has very important implication. We can use it in identifying the risk factors and see how to identify the risk groups and be able to design interventions to make sure that we mitigate we put down strategies, design strategies, and implement them such that they don't develop these conditions. So it allows us to look at diseases in a comprehensive way. Okay. I've used some quantifications in addition, where I said, okay, if smoking is 3, if this, no. That is very difficult. That's why I use the word hypothetical. It is just imagined. Okay, it is not really easy for you to say you have a genetic predisposition and you carry this exact chance of getting a particular disease. It is very hard to quantify really. So even identifying these risk factors is something very hard, but at least it gives us some good level of understanding of how this is really happening. So we move to socio-ecological model. This one is not different from one of the models that looked at different factors at different levels, where we looked at the micro level, individual level, and the macro level. It's the same thing here. We're saying that different interactions happen at different levels. Here, the emphasis is basically from individual level, interpersonal level, community, society, and even at the national level. There is interaction of many factors that affect the occurrence of a particular disease. Okay, and then the most common one in public health is another model is the social determinants of health model, which basically also not very different from the social ecological model. It's basically the recognition of the things around us that affect our health. Okay, where we go to school, where we work, where we live, then the policies at the national level, the resources, everything. So it still looks at individual factors, family factors, interpersonal factors, societal factors or community factors, and then the national factors. All these things will influence the level of health. That is the social determinants of health model. And then there is another one, which is the syndemic model, which is that you see diseases that happen in the populations do not happen out of the blue. There should be underlying factors that contribute to these factors. Okay, so by the time the person, for example, comes with, let us say, hypertension, this hypertension is happening because maybe they are not having a balanced diet, and that balanced diet is not being accessed because there are no systems, policies, or government programs to ensure that people access adequate food. So there is an element of injustice in a particular disease happening in a particular population. So diseases don't just emerge from nowhere, they emerge because of some people being left behind, marginalized communities. We can call them disadvantaged communities or communities of low socio-economic status. So that is what the syndemic model emphasizes, that diseases they are a manifestation of a rot that is happening in a society. Issues to do with poverty, marginalization, unemployment, and the rest, even wars. So how do you prevent these diseases? From the discussion, you already know the different ways of controlling diseases. If you looked at the epidemiological triad, you can know how to control diseases. If you looked at the component, sufficient component cause model, you know how to prevent disease. But here, the emphasis is about the levels of prevention, because this actually allows us to look at diseases in a more organized way, okay, and how we can really tailor our interventions. Primordial prevention. Usually we talk about 3, but in this presentation we're talking about 5 levels of disease prevention. So we are starting with the primordial. We are saying that Before the diseases actually emerge, there are risk factors that will always be there. Okay, so it is very important to address these root causes of diseases. Issues to do with poverty that I've just talked about. We need to make sure that people are having access to the same opportunities. There is no marginalization, no poverty, and things like that. If people are not poor, it means their nutrition, access to clean water, going to good schools, all these will actually play an important role in their health. Okay, so having all the things in place that make sure that the underlying social determinants of health are addressed is very key. Making sure that you have good roads, good hospitals, people are earning some good money, have all those are very important. They address the issues to do with social inequalities. And then now we move to what you already know: primary prevention, making sure that you prevent the disease from happening. You don't want a disease to occur. Proper nutrition, immunization, breastfeeding, these are primary prevention measures. Health education. With secondary prevention, you're focusing on early detection of disease. Remember, I started with the fact that some diseases are silent killers because they don't really manifest very fast. So a person will stay and they are not aware that they have a particular disease. So early screening is very important. It improves health outcomes, also improves how much money we will spend, the loss that will happen because of the disease progressing. Screening for cancer, screening for hypertension, these are common screening intervention that fall under secondary level. Tertiary, this is basically about focusing on managing the complications of a particular disease. It means that the disease has already progressed, okay, and therefore it's about rehabilitating the individuals so that they can still live with some good quality of life even with their condition. And then the last one, the quaternary prevention. These are measures that are aimed at preventing harm resulting from medical interventions or excessive care. Okay, so I don't know if you have ever witnessed this. There are individuals that could be having particular diseases, but the physicians and all the other health workers are really giving a lot of treatment for this case. Yet, this treatment is not actually very necessary. Okay, it's either there is need for palliative care so that the person can pass away peacefully, or the treatment is really reduced. Okay, so preventing harm to individuals from over medicalization or over diagnosis is what we call quaternary prevention. Okay, so that marks the end of this presentation. The takeaway message is that diseases are caused by multiple factors, and these factors have different ways in which they interact. As public health people, when we look at diseases occurring in populations, we should look at the different factors that can contribute or that are contributing to this disease occurrence. And that is when we can be able to design interventions that are appropriate to